station here on the campus at the corner of Bayview and Armistice. I'm here with my colleague today, Ilene Shiller, and we're going to talk about navigating life post-treatment and what happens, where to go from there. So the objectives of today, we're going to discuss our cancer transition coaching program as well as our returning to work program. And I will kick it off with our cancer transition coaching overview. We will be doing a Q&A at the end, so please, if you have any questions, just save them right to the end. So cancer transition coaching, the need. So a recent study by the Canadian Partnership Against Cancer found that 68% of respondents reported challenging periods post-treatment, and 42% of those couldn't get help to address their most difficult concern. The study also highlighted that patients had difficulty receiving useful information to meet their needs. Wellspring has a number of programs that can help address the emotional, physical, and practical challenges identified through the study. However, the challenge is navigating patients from the hospital to community-based programs. We've developed our cancer transition coaching program to meet the gaps in support identified by research for people who are post-treatment and have ongoing transition concerns. When patients complete treatment, in many cases, they continue to face the lingering issues, physical, emotional, practical concerns, long after they have been released from regular contact with their healthcare team. It's a time of great uncertainty and an ideal time for patients to turn to us at Wellspring. Research has also suggested that individuals prior to entering into the cancer coaching program do not have enough information about their concerns and lack adequate support. And this is the reason we created our cancer transition program. Our cancer transition coaching program really allows the member to talk about their story in full, to discuss their most important topics of concern in a safe and a trusting environment, filling that gap that was identified by research. Our program creates guided conversations, focusing on enhancing coping skills to support the practice of self-awareness in order to better cope with their biggest concerns. We ask members to identify their thoughts and feelings and help them understand how their thoughts and language influence these feelings and how our body reacts to them. With self-awareness comes choice for different actions, and that can enhance one's ability to cope. Our program aims to support members who are 3 to 18 months post-treatment through an educational and psychosocial coaching approach. Our coaching program is run by volunteer coaches. They work with members on their 3 greatest concerns and develop an actionable wellness plan to address them. Our program is very flexible, and it allows members to customize the program to their unique needs. As I mentioned, it's delivered by specially trained peer support volunteers, and it's done on a referral basis. So members can either self-refer to the program or they can be referred by their healthcare practitioners. Once we receive the referral, the member is then matched based on a number of criteria to one of our cancer transition coaches. That coach then reaches out to the member to address their needs and schedule their first appointment at a mutually convenient time. Our volunteer coaches work with members to really identify their top 3 needs and concerns post-treatment under physical, emotional, and practical concerns. And they typically meet the member 6 times over a 2-month period. Our coaching program follows the Bell model. So the Bell model is a holistic approach that really represents you as a being, and it's the intersection among 3 separate domains. So our body, our biology, how we move and interact with the world, our language, so what and how we think and speak both to ourselves and others, as well as our mood and emotional states. Each one affects the other, and then when you shift one, you move the others as well. Together, they really create a coherence of a current state of being, and each offer a powerful lever for change. The most sustainable progress comes from working on all 3. Through the Bell model, we cover 7 topics, so cancer-related fatigue, nutrition after treatment, that includes recipes as well. We talk about fear of reoccurrence, relationships after treatment, returning to work, which my colleague Ilene will be diving deeper into in a little bit, transitioning of care back to family physicians, as well as now living with uncertainty. Our program is very much a stepwise program with each session building on the other. In session 1, members are able to tell their story, and the coach will use that information to kind of help direct the coaching model and begin to explore some of the members' greatest concerns and challenges. The member also receives a binder. It contains a whole bunch of handouts that are completed following each session. So the coaching program very much is a work program. Members do have homework and are expected to complete it to really enhance their coping skills. On session 2, we work on identifying their top 3 challenges using a goal-setting framework and to begin to co-create an action plan to move forward with each goal. The coach also deep dives into what the Bell model is during this session. In sessions 3 to 5, we look at each goal one at a time. 3, we focus on the emotional goal, 4, the language goal, and 5 on the body goal. In the final session, it's a review of all of their goals. We focus on the accomplishments that they've made throughout the program, as well as we do a goal review and a wellness plan framework for developing a plan for well-being going forward. The coach will also assist our members on choosing other Wellspring programs that are best suited to them, that will enhance their well-being plan that's created. And if appropriate, we can refer the member to Wellspring short-term counseling program as well. And so the outcomes. So our research has shown that patients who participate in the coaching program have improved quality of life, emotional and physical well-being. We've seen measures of depression and anxiety significantly improve at both the 6-month and 12-month post-coaching, with scores of the PHQ-9 and GAD-7 decreasing from moderate to mild levels. Also, measures of fear of reoccurrence significantly improved out of 5 of the 7 factors that characterize it. So triggers, severity, psychological distress, functional impairment, and insight. And after coaching, patients have lowered social limitations, greater self-efficacy. They score higher on self-reported health, have an increased sense of control, and a greater engagement in relevant community resources. Our program really empowers and provides patients with an actionable wellness plan to take back control of their world and removing their dependency on their oncology team and back to their general practitioner's care. And now I'll turn it over to my colleague, Ilene.
Hello, everyone. If we haven't met, I'm Ilene Shiller. I'm a senior program manager at Wellspring, and my main programs that I look after are Money Matters, Returning to Work. I'm also involved in our brain fog program, and wear a few different hats over at Wellspring. So I want to talk to you today about our Returning to Work program. So focusing first on the need. So if you look at the statistics, you're going to see that the majority of cancer patients are of working age. And with increasing survival rates, there are going to therefore be more patients who are returning to work. And if you look at the studies, you're looking, at least 50% of cancer patients return to work. Of course, it's going to depend on type of cancer. It's going to depend on financial situation. It's going to depend on treatment, that type of thing. One study, as you'll see on the slide, was about 63%. A more recent study, a meta-analysis and systematic review published in 2019 found that about 57% of cancer patients return to work. So, given the number of cancer survivors and patients returning to work, interventions are absolutely needed to facilitate the return to work process. And in looking at what those interventions should address, it's been identified that cancer patients often lack information as to what the return to work process involves. They're uncertain as to when they should be returning to work, when they'll be ready to return to work, what's involved in dealing with their employers, what's involved in dealing with insurance companies if they're on some type of disability insurance. So lots of unknowns, and that uncertainty just adds to a whole pile of stress that they're dealing with. Patients also need assistance in addressing the concerns that they may have about a return to work. And in running the program, we've seen, a number of similar concerns continually coming up. So, number one is, I'm still continuing to have side effects of treatment. How can I return and do my work well if I'm dealing with brain fog, if I'm dealing with pain, if I'm dealing with fatigue? Some people will state that they don't want to return to their job because they think that perhaps the stress of the job might have contributed to the diagnosis. And for a lot of people, we know that cancer is a life-changing experience. Their priorities may be shifting, and they simply don't feel the same way about their job as they did before their cancer diagnosis. And that's why the Returning to Work program was created. It was to address those exact types of concerns, as well as to help group members assess their readiness to return to work, prepare for a return to work. So the overall goal of the program is a successful and a sustained return to work for those that choose to go back to their job. So let me tell you a little bit. Here's a snapshot of what the program looks like. So it's a 6-week online program. It's held once weekly, and it's for 2 hours, and it's led by a professional program leader. Each week, there's a homework assignment given, and that's a big part of the program. It not only helps them personalize the information that they learn each week, but it actually helps them prepare for return to work because they're doing an exercise. It flexes their work muscles. It gets them to work a little bit on their stamina, a little bit on their concentration. It's also considered an education and support program. We provide very helpful information and strategies for return to work, but a very big part of the program is the mutual support component. Group members get to share how they're feeling about returning to work and learn that there are others that feel the exact same way, and that validation is very, very powerful. They also get to see each week a video of a Wellspring member who has returned to work. And so that's a good way to see somebody who has been through the process, the sort of lived experience. They get tips from them, what worked, what didn't work, and it proves to be another very helpful component of the program. So let me take you through each of the sessions just so you get an idea of what's covered in the program. So session 1 is really trying to find out where you are in terms of a return to work. And so group members do a questionnaire that helps them assess their confidence levels, their anxiety regarding a number of return to work factors. So it looks at things like, how do you feel about going back to your workload, dealing with your boss, dealing with your coworkers, dealing with your side effects, that type of thing. And in discussing the results of the questionnaire, the group members engage in a helpful discussion about all of the challenges as well as the benefits of returning to work. And it's important to mention that the program does not take a stance in terms of whether the participants should or should not return to work. We pose it as a question for them. We give them the tools to help them make that decision, realizing that it is such a deeply personal decision that is dependent on, so many different factors. Session 2 starts the real work of the program. And so group members complete a very detailed questionnaire where they compare what their job requires of them and where they are in terms of meeting those requirements. So for example, if their job requires an 8-hour workday, they have to rate their ability today to be able to engage in an 8-hour workday. And they give similar ratings for all the physical and communication and thinking tasks involved in their work. And through that questionnaire, they get to identify what of their personal resources need a little bit of pumping up in order to get them job ready. And then they start the project of the program, which is their weekly goal calendars. And that's going to enable them to slowly increase their personal resources to better able them to meet their workplace demands. So they'll add to their goal calendars each week just very, very small, realistic, attainable goals. So there will be personal goals, increasing physical activities, working on their sleep schedule, things like that. But they'll also focus on what we call work-related goals that will enable them to live the life of work before they actually return to work. So maybe they'll do some technical reading. Maybe they'll increase the length of time that they sit and send emails. Maybe they'll just practice getting up early, getting dressed, and getting out of the house. So that's session 2. In session 3, it's geared towards helping group members understand all of their rights and responsibilities regarding a return to work. So we look at things like disclosure requirements, workplace accommodations, graduated return to work. And in this session, we also provide suggestions on how to communicate with employers and insurance companies, how to have those discussions. And we introduce a communication model that's similar to what actors use. So it's got 3 components of rehearsing, performing, and then applauding the work that you do in the discussion. Session 4 focuses on the emotional side of a diagnosis. So we provide a strategy for dealing with the grief and loss associated with a cancer diagnosis. And we present a model comprised of 4 tasks. So the very first thing is trying to accept the realities that come with a cancer diagnosis. Second, acknowledging the thoughts and the feelings that come with those realities. The third is finding ways to adapt to those difficult thoughts and difficult feelings. And then ultimately assessing and reinventing. So that gives the group members the opportunities to ask themselves those big questions. Now that this has happened to me, what comes next? What do I want for my life? And they can focus on their job at that point and see where, it now plays a role. And it's an opportunity for us to explore a little bit of post-traumatic growth as well. Session 5 focuses on self-care in the working world, and we provide some ideas and suggestions for ensuring that self-care remains an important part of group members' recovery and their life when they return to work. And it's all about not layering self-care on top of an already busy schedule. It's about focusing on time management skills, cutting other things out to make sure there's adequate room for self-care, and delegation if needed, enlisting the help of family members, friends, to ensure that you get to carry out the self-care. And in the final session, we put it all together. So it's a summary of the program. They get to do the questionnaire they did in the first session to see if their concerns and anxiety have stayed the same, perhaps improved, maybe gotten a little worse because they've had time to delve a little bit more into the issues that are concerning them. And then we, provide them with some suggestions for the next steps going forward. It. Any questions about either the cancer transition coaching or returning to work or anything else Wellspring wise?
Thank you for that excellent presentation. I wonder what type of follow-up after these sessions, like how do you know what your success rate is, and do you follow up on these patients to see what's happened?
So Emma can speak to the cancer transition coach. From the returning to work perspective, we do a post-group evaluation that just gives us ideas of very qualitative in terms of what they found helpful, what they didn't find helpful, geared towards making improvements to the program, finding out suggestions from group members. Yeah.
Yeah, we do the same with the cancer transition coaching as well.
Anyone else?
Can I ask another question?
Of course.
What type of for people who want to do this and be the coaches, what type of training requirements do you have for these people who do this type of training? Do you train people to do that, or and how do people get involved?
Yeah, so for our cancer transition coaches, our coaches are peer support volunteers. They've gone through our 4-week training to become a peer support volunteer, and they've generally been a peer support volunteer for at least a year at this point. Our coaching training is a fairly extensive training that we do provide. It is 2 3-hour sessions every week for an entire month, so 8 sessions in total, where we really dive deep into the Bell model and goal setting, goal framework. So it is quite extensive, the training they go through. Any other questions? You can put them in the chat too, if that's more comfortable.
All right. Well, if you do have, any other questions, please don't hesitate to reach out to MRI. It's just our first names at wellspring.ca in terms of contact information.
Yeah, and if you haven't come to Wellspring yet, please do so. We're open every day, Monday to Friday, 9 to 5. So please take a walk over on your lunch break, or if you just need a break to take a walk, please come over. We'd be happy to give you a tour.
Excellent.
Okay.
Thank you,
Well,
everybody.